Howdy y'all, welcome to another episode of Poop Tip Tuesday, where every Tuesday I answer your questions you guys have about your gut health. If you want your question answered, here's what you need to do. Subscribe to my channel and newsletter, where every couple of weeks I'll send out a survey requesting questions that you can ask me to answer as well. If you haven't already, don't forget to smash that like button, like, share, and subscribe, or you can send me a message or a DM through social media. It's not the best way to get a hold of us, but that is one way that we can maybe answer these questions as well. If you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. My passion is to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, smash that like button, like, share, and subscribe, and come see us at Lubbock Gastro, where we can take care of all your GI health needs. All right, we have a great show today. We have 3 topics I want to discuss in today's video. We'll discuss tomatoes and their risk for arthritis. We'll discuss some natural remedies I recommend for gastritis, and we'll talk about a core topic called gastroparesis, where we can go in depth about what that condition is and how do we diagnose and treat that. Guys, let's begin. All right, first question. Hey, Dr. Islam, I heard that tomatoes are bad for arthritis. Is that true? Let me know in the comments down below if you've heard that, if that's something you've discovered, or have you also had your own experience with tomatoes and worsening arthritis. Now, we do know that tomatoes do have an anti-inflammatory component to it. It has an ingredient called lycopene. This has an anti-inflammatory effect. So for some individuals, it can actually make their inflammation get better and actually improve their arthritis as well. However, it is part of the nightshade family, and there is a thought, though the evidence is not so great, that nightshade family can make arthritis and it's a little worse. There is an ingredient in tomatoes called solanine, in which some people reportedly say that can make inflammation worse and joint issues worse. I will tell you, in terms of actual evidence, we have no evidence that is the case. So I would not worry about that. And the most important thing is that every single person is individualized and different. So even though I'm telling you that we don't have a lot of good evidence that tomatoes are bad for your arthritis, your body's response is the best predictor if that's the right option for you or not. Meaning, if you take tomatoes and you feel bad, you have joint pain, you're like, what's going on here? Things are getting worse. That is your body's response to that. And so your particular needs may be different than what everyone else's as well. So what I tell all my patients is that the best test by far is your body's response to whatever you're doing. It's better than any blood testing. It's better than any imaging. It's better than anything else. So use your body as a guide to see whether you should have tomatoes, especially if you have arthritis. Second question. Hey, Dr. Islam, I have gastritis. What are some natural remedies for me to get this taken care of? There are 3 main things I recommend to help healing up your gastritis naturally. Now, keep in mind, this is under the assumption that you've already done the things that cause the gastritis to begin with, meaning stopping smoking, alcohol, not taking anti-inflammatory medications. I'm assuming you've already done that as well. Number 1 is ginger. Ginger has anti-inflammatory properties, and I love ginger for a lot of GI issues, including gastritis. Helps to soothe the stomach, helps to soothe pain, and allows your stomach to heal up on its own. Now, the best ginger I recommend is ginger root that's in tea. I found that to be the most effective way you can hopefully heal up your stomach. Now, I know it's easier to get a ginger tea pack, and that's okay, but if you actually can get the root and you can soak it in hot water and drink that tea, I have found that to be a more effective way to get the best benefits of ginger. It has a lot of anti-inflammatory effects. It also has a lot of antioxidant effects, which can both help out when it comes to gastritis. Number 2, probiotics. When you have gastritis, it sets off a cascade of a change in your gut microbiome, in which you have more bad guys and less good guys. So adding prebiotics and probiotics are a way to rebalance your GI tract. And the best way by far to do this is with diet. A diet that has a wide variety of plants and vegetables is the best way to do this to improve your gut microbiome. Include foods like miso, kimchi, vegetables, yogurt, kefir, sauerkraut. I found this to be a more effective way to change your gut microbiome and heal up your gastritis than maybe taking a probiotic. And then lastly, slippery elm. Slippery elm is a natural ingredient that's been shown in clinical trials to help out with gastritis, to help soothe the stomach, make it easier, and allow things to not be as hard on your GI tract. It can help soothe the stomach lining, reduce inflammation, thereby reducing the symptoms of gastritis. Now, it's typically consumed in tea or in some sort of powdered mix. Try this to help out with your gastritis. Now, with everything I recommend, you always need to make sure you speak to your healthcare provider about the risk and benefits for your individual case. Everyone is different when it comes to their symptoms in their bodies, so make sure you speak to your doctor about the recommendations you may want to implement. Let me know in the comments down below, what have you tried to help out with gastritis? Have these things worked for you? What hasn't worked? What has worked? Let me know so I can learn more from my patients and so my audience can learn as well. So now we're going to do a deep dive on gastroparesis. What is it? How do we diagnose it? What are the symptoms and what are the treatment? So gastroparesis basically is delayed gastric emptying, meaning your stomach is not working as effectively or efficiently as it should. So whenever we eat, our stomach is churning and moving things down to break the food down into its smallest component to be digested into the small intestine. When you have gastroparesis, your stomach is not working. Food just sits there because nothing wants to move. Your stomach doesn't want to contract, and it just sits there and sits there and sits there. And there are a lot of reasons why people can have gastroparesis. One of the more common reasons is sometimes after a surgery, especially in the upper GI tract, the vagus nerve, which is the nerve that innervates the stomach, can get cut to cause your stomach to not work as effectively or to move things along. A second common cause is diabetes, especially if you have poorly controlled diabetes. You have eye problems, you have kidney problems, you have joint problems, and you may have stomach problems. The diabetes can affect your stomach to cause it to slow down and cause gastroparesis. But another reason is that we just don't know. Some people develop gastroparesis and we have no idea why that's the case. That is called idiopathic gastroparesis. So what are symptoms of gastroparesis? The most predominant symptom is nausea and vomiting after you eat. And that makes sense because when you eat, your food just sits there. And if it sits there, it ferments. It doesn't go anywhere. And it just, you're feeling bloated and you have the nausea and vomiting after you eat. That's a very typical symptom of gastroparesis. But you can have other symptoms on top of that. You can have pain. You can have bloating. You can get full quicker than normal. You can have constipation. You just don't feel good. You just feel sluggish all the time, like something's stuck right here. But the most predominant symptom is nausea and vomiting after we eat. So what do we do? How do we diagnose gastroparesis? Well, first we have to have a clinical suspicion of that. So I have a diabetic who has really bad diabetes that has nausea and vomiting after they eat. I suspect that gastroparesis is the first cause for that. So what do we do first? The first thing we have to do is that we have to do what's called an upper endoscopy or an EGD. Why is that? The main reason is that we want to rule out any type of anatomical reason why you're having the nausea and vomiting. So for example, you could have a big ulcer in your stomach that can mimic gastroparesis that we won't know unless we take a look with an upper scope. You could have a blockage in your stomach. You could have a narrowing in your stomach. I can't tell you the number of patients that came to see me for their gastroparesis. We did a quick upper scope. We found another reason for their issues. We fixed it and their gastroparesis went away. So the first thing we do is an EGD, an upper endoscopy, where we put you to sleep. We use a small camera. We take a look at the small intestine and see exactly what's going on. If that ends up being normal, the next test that we do is called a gastric emptying study. This is basically where you eat some eggs and we see how long it takes the eggs to leave the stomach. Here's the important thing you need to know. It must be a 4-hour test. Now, you may have been diagnosed with gastroparesis based on a 90-minute study. That is not accurate. We don't use that. It's got to be a 4-hour test. And in 4 hours, almost 90% of the food has already left your stomach. That gives us a diagnosis of gastroparesis. Once again, it has to be a 4-hour test. Now, there are other tests that are out there, including the gastric emptying breath test or a wireless capsule, and that can be used also to diagnose gastroparesis. So once you have the diagnosis, what do you do? Well, the first step is hydration and nutrition. We typically recommend our patients to make sure they're hydrated and have small, frequent meals throughout the day, low in fiber and low in fat, usually about 6 or 7 meals per day. It's like you're grazing throughout the whole entire day. You may have to have supplements to help out with that, like shakes, but make sure you don't have a lot of fiber because that can sit in your stomach as well. So one of the very few times I don't recommend fiber. Now, there are a couple of medications that are approved for gastroparesis. One is called metoclopramide or Reglan. This actually helps out with the contraction of your stomach. This is FDA approved for those individuals that have gastroparesis. Now keep in mind, it's only approved for 12 weeks at a time with a 10-day interval in between each one to hopefully minimize the side effects that can occur with metoclopramide. Now there are some side effects. You can get Parkinson's-like side effects or a condition called tardive dyskinesia, which is involuntary twitching of the mouth. Now other medications can be used to help out, including antiemetics, anti-nausea medication to help out when it comes to the symptoms of gastroparesis. And it's in a subset of patients, you can actually consider surgery or even endoscopic therapy in the right patient to help out with your gastroparesis. This is kind of the lowdown on gastroparesis. If you want me to answer more questions about this condition, comment down below. Let me know what questions you have, and I'm more than happy to make more videos on this. I want to thank you for watching. Don't forget to join me every Tuesday where I answer your questions on Poop Tip Tuesday. Come see us, subscribe, and let us know what we can do to get you taken care of. Come see us at Lubbock Gastro.